According to recent government statistics, pain medication addiction is the fastest growing of all addictions. We spoke with Dr. John Massey in Los Gatos, California, who gives us more on the brain mechanism of addiction and pain.
People in pain are miserable. Their life is full of pain. They can't move. And suddenly they have a medicine, an opioid, a drug, and they take it. And they get a massive release of dopamine in their brain. Dopamine is a drug within the brain that motivates people positively. It's the same kinds of things that you see for fast food. It's the kind of things that you see in runners who say, I have to run, because they get that runner's high. It's a massive release of dopamine. Well, we can do that with medicines. By far, the largest population of patients that we see with chronic pain have nothing to do with addiction. What we're talking about is some of the side effects associated with the medications used to treat chronic pain. Because if you had to take narcotics, OxyContin, methadone, morphine every day, you're going to find out that while you may get a rush of dopamine, it may be short-lived. In fact, you may notice that the dose has to go up to get the same rush, and pretty soon you may be very dependent on that drug. We give patients opioids as a primary therapy for chronic pain. Very well understood, standard of care, but I will tell you that when you start taking that medicine every day, your body becomes dependent on that medicine, so that if you didn't take it one day, you'd have withdrawals. That doesn't make you an addict, that makes you physically dependent. It's very, very different.
Dr. Massey gave us an example of someone who takes medication for pain and the difficulty in getting off those medications.
Average patient who comes in who's had 2 back surgeries, who may have been in bed or close to being in bed for half of a year to a year, who has pain every moment of every day, who has developed a lot of depression, despondency, and yet they have this medicine that whenever they take it gives them a bump of dopamine. Well, you can see where that might be used then to treat their depression, because it alleviates the depression in the short term. But in the long term can actually make it worse, especially the more dependent you become on the medicine to get your dopamine. It's a cycle that's very, very difficult to break.
And what about the current rate of addiction?
The current rates of addiction and pain management through the literature range about 3 to 18%, and I'm going to tell you it's more like 3%, so it's a very small problem. But if somebody truly is an addict, that means that they have out-of-control medication usage and can really focus on nothing but acquiring more medicines. And that is their primary motivation, to hit that dopamine receptor. And to try to get somebody to engage in a process of a plan to get better while that is going on, it's impossible. The addiction has to be treated first.
Are there any breakthroughs in pain management and the treatment of addiction?
The biggest medicine that is out there right now is buprenorphine, and it's going to markedly change the picture and the landscape of pain management. And you're going to see that medicine take a forefront in the treatment of combined opioid dependency and pain management.
And what's the biggest problem today in regards to doctors treating pain?
The doctors and patients who are managing chronic pain really are planning. The plan is from week to week or month to month, but there is no cohesive plan about how do we get your life back. What you want to be able to tell them is you can have this problem and have a great life. You can have this problem and be perfectly healthy. And if you don't add those two things together with your physician, you're getting nowhere.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this PBS station.